In the adolescent stage, sometimes substance abuse can become a very serious problem. Substance abuse is defined as repeated harmful use of alcohol and or other drugs. Now, if the person develops a very serious addiction, they might receive the diagnosis of substance abuse disorder, which is marked by negative disruption of life. So, first of all, if a person's work or school suffers, that's a big red flag that could indicate substance abuse disorder. So, in the case of adolescents, school is a real big one. And if we notice that a student's grades are really declining, maybe an A student suddenly is failing all of their classes, that's a big red flag that maybe something else is going on. Also, if a person's work suffers, so in the case of an adolescent, maybe they have some kind of part time job after school, and now they're not showing up to their part time job, or they're showing up late, or they're showing up to work high, or something like that. That's a big red flag that could indicate substance abuse disorder. Another big one is the person's relationships. If their friendships suffer, if their family relationships are declining, or the romantic relationships, that can indicate substance abuse disorder. So, for example, maybe a person's friends say to them, "Hey, are you going to drink tonight? Because I don't like the way you act when you're drinking, and I don't really feel like going to the party with you if you're going to be drinking." Something like that. That's a big red flag. And then the last one is if the person's physical health is jeopardized by the use of this drug or alcohol, that can indicate substance abuse disorder. So, smoking cigarettes is a great example for this one. Sometimes people smoke cigarettes, but they're still doing okay with their work and their school. Their relationships are still okay. But because there's no question that smoking cigarettes increases a person's risk for lung cancer and other respiratory diseases, we consider that to fall under substance abuse disorder. So, something to keep in mind. When we're thinking about substance abuse, it's important to understand the two different types of addiction. There is physical addiction, and then there is psychological addiction. They are different but related. So, physical addiction is when a person stops using a particular drug, they experience physical withdrawal symptoms such as nausea, headaches, fever, shaking, vomiting, flu like symptoms, etc. On the other hand, psychological addiction is marked by a very strong craving or desire or obsession for a drug or activity. So, examples of physical addiction could be a severe alcoholic trying to quit alcohol. And when they try to quit alcohol, their hands shake and they can't steady their hands. Or another example could be a heroin addict, and when they try to quit, they experience severe flu like symptoms. They're nauseous, they have headaches, they feel like the walls are closing in on them. And it's important to understand that physical addiction really adds to the danger of a particular drug because it makes it very hard to quit the drug. Because these physical withdrawal symptoms are often so painful and so uncomfortable that it's hard for the person to make it through this period. And of course, another dose of the drug will alleviate these painful physical withdrawal symptoms. So that really makes it difficult. It's not impossible, but it makes it difficult to get off this drug. Now, psychological addiction can also be very powerful and make it challenging for a person to get off the drug. Now, I want to mention that it's not just drugs that can be psychologically addictive, but there are a lot of activities that have the potential to be psychologically addictive for some people, such as gambling, stealing, lying, sex, overeating. These are examples of activities that can be psychologically addictive, but they're not physically addictive. So a person can be addicted to gambling, let's say, and they just can't stop. They can't stop gambling. But when they do try to stop, they don't experience physical withdrawal symptoms. They don't experience flu-like symptoms, for example. So that's the difference between physical addiction and psychological addiction. And it's helpful to understand the different types of addiction when we're thinking about the serious problem of substance abuse.